Your ICU patient has a rising bilirubin. What do you need to consider? A high bilirubin or jaundice in the ICU setting is very common. Several diagnoses always seem to pop up, so you should be familiar with the following. What you have to do at first is determine whether the cause is extrahepatic or intrahepatic. Extrahepatic causes is usually obstruction. So usually getting an ultrasound to see if there's dilated bile ducts is a good way of excluding an extrahepatic cause. And if that's not the case, we're dealing with things that are intrahepatic. Certainly the common things in the ICU setting would be cholestasis of sepsis. Remember, sepsis of any kind can lead to some hepatocyte dysfunction. And cholestasis will ensue. Furthermore, many of these patients are on antibiotics, and these frequently cause cholestatic reactions. Of course, other drugs do as well. A third thing would be if they're being fed through TPN. TPN is notoriously harsh on a liver, particularly a sick or cirrhotic liver, so make sure you exclude this. Also, if you can figure out whether the patient has cirrhosis, one of the decompensating events of cirrhosis is jaundice, so think of decompensation. If the patient is a cardiac patient, you can think of a failing heart leading to passive congestion of the liver and the development of jaundice. One potential clue here is that the hyperbilirubinemia will be indirect rather than direct. And that seems to be illogical, but it's the case. Finally, what you really have to do most of the time is conclude that it's multifactorial. Just make sure that there's not something that's reversible and easily treated, and otherwise it's supportive measurements. Good luck.